Friends, today we will discuss about the preparation for pediatric job interview in NHS. Overview. The purpose of this presentation is to understand the common pediatric scenario in NHS interviews. There are specific scenarios will be given and you will be judged accordingly, and how to approach the clinical and non-clinical questions, structuring answers using logical framework. Nowadays getting NHS job is very competitive, so you have to be very smart, you have to show your capability, and you have to be very specific regarding the answers. First, let's discuss about the pediatric emergency scenarios. Example: a 5-year-old boy come to your emergency or clinic with status epilepticus. So this kind of scenario is very frequently asked during the several interview sessions. So first, you need to describe in that way. You need to know where is the setup, whether it's a clinic or it's a hospital ward or a emergency. So, and you need to know about your team member, whether any SHO available or not, whether any consultant available or not, any nurses available or not. So you need to know your team very well. First, you need to allocate the responsibility. Who is going to take care of the airway, who is going to do the cannulation, who is going to document, so who is going to take in charge of the monitoring. So every point is very important, and you need to write the weight flag, the weight, energy, tube size, fluid, lorazepam, adrenaline, and glucose dose in a whiteboard, so that if any requirement of these drugs or fluid, that can be available quickly or they prepared so quickly. Then if the child arrive, you need to start to do the A to E assessment: airway, breathing, circulation, disability, environment. So this is very important. Stick to the basics. Okay, secure the airway, give oxygen if there is if the child is having work of breathing. Establish IO line or a IV line according to the need of the situation. Draw some blood, collect it, and send it for the investigation and do the blood gas. The first line medication for status epilepticus is lorazepam. Second line treatment may be required in terms of giving phenytoin or levetiracetam, and escalation to the anesthetics or the PICU if necessary. If you need some help, always call for help. The key point for this scenario is structured A to E response. You need to know the EPLS algorithm, early recognition of deterioration. That's the main crux of this scenario. And clear communication with the team. Your communication and leadership will be assessed in this scenario. Then the neonatal emergency scenario. Suppose preterm birth is imminent, like 28-week old with poor respiratory effort, how you should approach. And again, you need to know where you have been, either in the ward or the OT or in the lift. So you need to know where you are first. And second thing, you need to know who are your team, who are the team members available there, whether any midwife available or a nurse is available there, who can take the who is going to take the airway, who is going to monitor the heart rate, who is going to give the support in terms of documentation, doing cannulation. So these are the things you need to describe. And again, you need to check the instruments. Okay, the ET tube size, the warmer is working or not, the PEEP and the positive pressure ventilator, the TPC is working or not. You need to check the pressure, reduce it to PIP, reduce it to 25, PWP to be 5. So you need to check all these things. So in lot of hospitals we are using the live start for for the good temperature control. So you need to wear the PPE, the gown completely, make it a sterile environment, and keep that light board towards the patient, and take the patient and try to do the delayed cord camping, but it's all depends on how the baby is doing. Then provide some warmth by means of, in the lifestyle environment, you need to arrange a plastic wrap as well as the transdermal warmer. Position the baby airway to be secured, and start positive pressure ventilation if required, and consider intubation if it is necessary. If we are doing the long ventilation and if there is a requirement, you may consider the intratracheal intubation. And we may need to insert the UVC line. Most of the time we are doing bloods as well as giving total parenteral nutrition through the UVC line. We may need to insert the EVC line for the blood pressure monitoring as well as doing blood gases, and start surfactant therapy if it is required. Here we are using the Poractin most frequently. And the key points: be familiar with the NLS principles, NLS algorithm, and important teamwork and leadership is required. And effective communication between the neonatal team, always ask for help if it is required. Below 30-week gestation, the delivery should be attended by the consultant. So whenever you are getting a call, always inform the consultant beforehand. Let's discuss with the safeguarding scenario. Suppose a 3-year-old boy with parents presented with multiple bruises, inconsistent history. How you approach? You need to take proper history and considering the non-accidental injury indicators. Okay, a proper history and a proper documentation is very important because it will be used for the legal purpose. So you can take one of the colleague with you. The chaperone is very important to be with the patient and take the detailed history, then do the examination and document it. A body map is very important. You can do a body map and just write prepare the CP medical child protection medical pro forma. There is, every hospital has their own pro forma. Be familiar with that so that answering this question will be very much easier then for you. So always just try to document all these things, the length of the bruises and the marks, everything has to be documented correctly. And then you need to do the management. The immediate management is to give support for the proper specific treatment for the injuries, as well as immediate safety assessment, and refer this patient to the safeguarding team, local social services. And after that you may need to do some investigations like the full blood count, using is LFT, coagulation, bone profile, as well as we may need to order the skeletal survey to rule out any posterior fracture or anything. Sometimes if the baby's sensorium is not looking good, you may need to give referral to the CT scan to rule out any basal skull fracture, as well as if required give a referral to the ophthalmology as well. And then after all these investigations and everything, next day you need to prepare the full report and it's forwarded to the safeguarding department as well as your consultant. So this is the way the things are happening, and next day a multidisciplinary meeting will be arranged, CP medical meeting. That's the strategy meeting we call it. The key point of this scenario is to remain non-judgmental, act in the child's best interest, and follow the hospital protocol for the safeguarding cases. And the fourth one is a quality improvement scenario. Suppose you have been told like any medical error has happened, how you escalate it to So first of all, when a medical error like the gentamicin that is very frequently happening, one of the common scenario where the drug error is notified, so you need to detect it and just go to the patient party and take the apology and be very calm manner and give the right information, but you can't reveal the name of the concerned person associated with this error, because it's a whole teamwork and it's a departmental responsibility. And give the correct information and try to do it empathetically. And then you need to do the tactics and follow the plan, do, study and act approach. Plan is to identify the problems, set a smart goals like specific, measurable, achievable and relevant and time bound goals, and implement the medication double check system, monitoring for error rates, and adjust the protocol based on the feedback. The key point of this QIP scenario: the clear aim and measurable outcome, engagement with the multidisciplinary team, sustainability and long-term impact. This QIP scenario is very frequently asked. Try to be familiar with the audit and the QIP things. So it will help in your near future when you have been working in NHS. So every 6 months you should do an audit to show your capability and quality of work. Common pitfalls and how to avoid them. First of all, the lack of structure. While answering the question, you can't do the answer haphazardly. That showed you are not comfortable or confident, or even not familiar with the situation. So try to be calm as well as stick to the basic, the A to E approach or the ISBAR approach, the situation, background, assessment, and recommendation. Proper time management is very important. Stay concise, don't give overcomplicating answers, stick to the key priorities, and forgetting teamwork and communication is one of the pitfall. So try to highlight those teamwork and communication consistently with every emergency scenarios. You can't in NHS you shouldn't do any individual practice, combined practice. So all depends on the teamwork. The success of the treatment depends on the teamwork and how you communicate well with the patients. Tips for success: stay calm and professional. Just take it as you are dealing with a real-time patient. Use structured approach. Try to be familiar with the EPLS NLS guidelines. Communicate clearly with the panel. If you have any doubt or if you don't understand the question, you can ask. There is always a chance to improvement, so don't get disheartened if the outcome is not in your favor. Always ask for the feedback if you fail to qualify for an interview, but always ask for the feedback. That's how you should get to know that's how you get to know where you are standing, what is your quality, and where you need to do some more work, and reflect your practice, so willingness to learn. Thank you very much. If you have any question, if you want to do some discussion or mock interview or mock test for the MRCPCH clinical examination, you can contact me. Thank you very much for your support. Like, share, and subscribe my channel. Thank you very much.